Hello, my name is David Trimberger, and I am going to be answering the Module 3 question 1 question. So for this discussion question, it is asking us to choose 3 out of the H's and T's of ACLS other than hypoxia or hypovolemia. So for the first one that I decided to choose was going to be a tension pneumothorax. You can be able to determine that someone's having a tension pneumothorax if they are showing signs of JVD, tracheal deviation, unequal breath sounds, as well as difficulty ventilating, and then there's no pulse whenever you are providing CPR, or you can't feel a pulse whenever you're providing CPR. In order to officially treat this, you'll need to perform a needle decompression. My next one that I did was hypothermia. You can determine that someone is having hypothermia because they are going to be shivering or they have been previously exposed to colder temperatures, as well as you can take a temperature on them as well. Some ways that you can be able to help get them warmed back up is you can do active warming techniques, so meaning turn the heat on in the ambulance, you can wrap them up in a blanket, you can just try everything you can to be able to keep their body heat in, to be able to conserve that body heat that they actually do have, and just trying to actively rewarm them. And then your goal is you want to try and maintain a temperature above 30 degrees Celsius. For my final one that I have is a hydrogen ion excess or acidosis. So if someone is having respiratory acidosis, you want to make sure that you are providing adequate respiration. So you may need to be taking over their respirations and making sure that they are being able to get them adequately, as well as if they're having metabolic acidosis, the true way on how you treat that is going to be with sodium bicarbonate. Some ways that you can be able to tell that someone is having acidosis is if you look at their ECG, they have low amplitude QRS complexes, but the true way to be able to determine that is with a arterial blood gas test. Thank you for listening. Those are my responses.